Broadcast is now starting. All attendees are in listen-only mode.
Good evening, everyone, and welcome to the Florida Society of Interventional Pain Physicians webinar. We are so glad you have joined us tonight. Thank you so much for your time. We will begin the webinar promptly at 7:02 to allow a few more folks to join us. Again, thank you for joining the FSIPP webinar tonight. We are excited to get this launched in just 2 minutes. Good evening, everyone, and welcome to the Florida Society of Interventional Pain Physicians webinar. We are so excited you've joined us this evening for the webinar. We will begin the webinar immediately in 1 minute to allow a few more people time to log on. Again, thank you so much for joining us tonight, and we will begin promptly in 1 minute. Good evening, everyone, and welcome to the Florida Society of Interventional Pain Physicians webinar. We are so excited you've joined us this evening. I would like to introduce our president of the Florida Society of Interventional Pain Physicians, Dr. Jesse Lipnick. Jesse, take it away.
Michelle, thank you. Thank you very much. I would like to start tonight's webinar by first thanking everybody who has participated and everybody who's made this possible. First, Michelle and her group, Mantra Meetings. You guys are awesome, just amazing. Thank you for all the hard work and all the foresight. Just wonderful. Next, Harold Cordner, that you are about to hear. He is the current president of FSIPP and just dynamite, and thank you, Harold. Also, Judith Holmes, a terrific, wonderful attorney who has spent her career defending doctors, and we're going to hear from her. And then we're also going to hear from Dr. Hans Hansen. And thank you so much, Hans, for participating. Hans is a past president of FSIPP, and I'm just very thankful that everybody has participated. Now, just by way of update, the Florida Society of Interventional Pain Physicians will be having its annual meeting July 17th in Hollywood, Florida. We're going to be at the Diplomat. And I just want to say that we have spent a terrific amount of time putting together the safest possible meeting for everybody. We are very well aware that we are really one of the first meetings that's going to be happening in this COVID pandemic that we've all been living through. And we are doing everything possible to make the venue safe. We are rotating attendees from the lecture hall to the exhibit hall, and even into the posters, and we are going to keep people distant. In addition, we're going to have people masked. We're going to maintain our distance. We're going to have hand washing stations. We are doing everything to assure our safety, but also to continue life. And I'm just very pleased and happy that we can do that. Okay, so by way of introduction, I'm Jesse Lipnick. I am the current president of FSIPP. I'm a private practice doctor in Gainesville, Florida, and I've been here for about 25 years, and I'm just very pleased to be with this group. So let's get going on my presentation. So the presentation that I'm going to give you tonight was written by Harold Cordner. So Harold wrote it last month, and he didn't want to do the whole webinar. So I'm giving Harold's presentation, and it's just marvelous. What I'm going to talk about are guidelines for reopening America and getting back on our feet. We're going to cover White House recommendations, then we're going to cover some CDC recommendations, and finally, we're going to cover FSIPP recommendations. So, forward, please. Okay, so this is going to be a proposed phased approach. It's going to be based on up-to-date data. We're going to mitigate the risk of resurgence. Everybody's talking about the second wave that we're supposed to have now, but we're going to do our best to flatten that. We're going to protect vulnerable people, and different regions are different. So if you're in the middle of a city or if you're in a rural area, we're going to have to create conditions that lend themselves to your particular area. Now, here are recommendations for individuals, and this is coming directly from the White House. The first is vulnerable individuals must maintain a greater level of protection and sheltering than other people. So we want to be sensitive to that. Individuals should continue to distance themselves socially. Don't gather more than 10 at any one place or time, and minimize non-essential travel. Now, I'd like to just specify that we are in phase 1 of the recovery. And so we're there right now, and these will continue during phase 1 until we go to phase 2. Next slide. Okay, so for employers, there are also some rules and some guidelines. Number 1, encourage telehealth activities. Now, this is really for all employers. This is not just for doctors. Return to work in phases. So that's exactly what we're doing now. We're in phase 1 and we will advance. Close common areas. We don't want people gathering together all at once without social distancing. We want to minimize non-essential travel. And finally, consider special accommodations for anybody who's vulnerable. And we're going to go over later in this presentation what vulnerability consists of. Advance. Okay, so there are specific types of employers. So hold on, I think we went a little far. Go back. One more. Yes, that's it. So we're on specific types of employers. So first of all, we begin with schools and organized youth activities. So we're talking about public schools here, and we're talking about colleges. And for the time being, at least in phase 1, they are to stay closed as per the White House. Senior living facilities should limit visitors, and those who do enter senior living facilities should observe strict protocols not to expose the people living there to any kind of risk. As far as large venues, so we're talking about football games or sporting events, strict social distancing applies. Next is elective surgeries. Now, I know that we were in a phase before phase 1 where we shouldn't do them, but now we should resume them as long as we adhere to CMS guidelines. And we'll go over those later in the talk. Gyms, they can open as long as people socially distance. Bars are still closed, so not good for the bars. Okay, so here we have a quote by Sir Winston Churchill: "A nation that forgets its past has no future." Thank you for that, Harold. Okay, now there are prerequisites for all those things that I just read to you from the White House website. And so these are things that must be done before entering the phase 1 recovery. Number 1 is that there should be a downward trajectory of cases for a 14-day period. So that applies to that remark about different geographic areas. So maybe you're in an area where cases are going up. And if that's true, then you're really not ready for phase 1 of the recovery. But if you're in an area where cases have been going down for 14 days, then you are ready. Also, hospitals must test all at-risk patients and employees. So really, this is really a vote for testing, and we'll get into testing and the different kinds of testing a little later in the talk. Next. Health systems required elements. And this is really your medical practice or our medical practice. So a couple of key things, everything we've set up until now, but in addition to that, we must all have sufficient PPE, personal protective equipment. Also, hospitals need the ability to handle a surge in ICU capacity if that comes to pass. All right, now next, and if you would just move ahead one slide to the USA Today slide. Yeah, there we go. All right, so as far as testing goes, there are two kinds of testing that are listed here. So one is antibody testing. Now, when you're testing for antibodies for COVID, the first response that someone has is an IgM response. Later comes the IgG response. Somebody becomes positive for antibodies 1 to 3 weeks after infection. So the idea here is that you can date the infection. If you have IgM but not IgG, then it's a newer, a more acute infection. And when you're testing for antibodies, what you're really testing for is to see if somebody has had it in the past. Now, next is a PCR testing assay. So that's polymerase chain reaction. And what that is you're looking for the protein of COVID itself. And what that says is if there's any active infection going on right now. So one of the limiting things about these tests is that they're immunoassays, which we know have about a 25 to 30% false positive and false negative rate. So there's some amount of inaccuracy in them, but right now they're the best that we have. Next. Okay, so this is guidance from the CDC. So everything we've had up until now has been White House. Now we're in CDC recommendations, and this is guidance on when to come back to work after an infection. Next slide. Okay, so wait, return to work. Yeah, so there are really two strategies. One is called a test-based strategy, and the other is called a non-test-based strategy. That is, the non-test-based strategy is based upon symptoms of illness and recovery. Next. For the test-based strategy, so you should exclude from work until there is resolution of fever without any medications, there's improvement in respiratory symptoms, and you have 2 negative nasopharyngeal swabs that are separated by more than 24 hours. Now, these nasopharyngeal swabs are no joke because they're based on cellular input, which means you have to get cells off the inside of your sinus. So they're pretty painful. You really have to jam them in and get cells. And you need 2 negative ones on the test-based strategy. Next. On the non-test-based strategy, the employer should exclude from work until 3 days of full recovery and 7 days since the initial infection. Number 2, if the person is asymptomatic, 10 days since the first positive COVID test. And if there's an alternate diagnosis, so let's say, for example, somebody has influenza, then return to work would be based upon whatever recommendations you would have for that diagnosis. Next, these are return to work. The employees should, couple things. Number 1, wear a face mask. That's for source control. It's important to understand that these face masks do not prevent you from breathing in the virus. What they do, hopefully, is they prevent you from transmitting the virus. When you have an N95 mask, what that means is that 95% of the particles that are 3 microns or greater get stopped by the mask. The COVID-19 itself is about 1.2 microns. So it freely flows through these N95 masks. However, when you're wearing one as a method of source control, it prevents any kind of aerosolization that's bound up with water or mucus or any kind of anything that will get caught in the mask. So it really prevents transmission. So you should wear a face mask for source control until all symptoms have resolved 14 days after onset. Not a cloth mask. So the CDC specifies that. Restrict contact with immune compromised people for 14 days, and everybody should self-monitor for symptoms. Next. The CDC has interim infection control and prevention for patients with COVID-19 in healthcare settings. Next. So CDC guidance for source control. Number one, reduce the facility risk. This was canceled, but now we're supposed to move forward with elective procedures. We're still using telemedicine when needed. That is, if somebody is vulnerable. We're limiting points of entry into a healthcare facility. So you can't have people coming in the back door, and manage visitors and employees. We should also isolate symptomatic patients as soon as possible. Set up separate areas with closure and ventilation. We should also protect personnel. Wash hands, install barriers, limit contact, prioritize respirators for hospitals. So, as I said before, we're in phase 1 of the recovery, so we're not canceling every elective procedure. We're talking about a second wave, but we don't yet know when it's going to come. CMS, as of last week, is encouraging Medicare Advantage plans to use telehealth in rural areas. So it looks as though when COVID-19 is past, we've got telehealth. And maybe this will be a solution to one of the problems that we've had, which is providing care in rural areas. Okay, so now we are ready to move on to the FSIPP risk mitigation strategies. How do we return to work and reduce the risk of infection and reduce the risk of injury? So one is we have to define vulnerable individuals. So what are the risk factors that govern whether or not someone is vulnerable? Number one is age. Next is underlying health conditions. So we've got hypertension, chronic lung disease, diabetes, obesity, asthma, or compromised by chemotherapy for cancer. Next. Okay, thank you. Now this is a little small. I didn't get it on here exactly right, but what this does is it gives us a grading system for each risk factor. So up at the top there, you see you've got age, and low risk is 45 to 64 years. Moderate risk is 65 to 74, and high risk is over 74. Now, each one of those categories gets a point, 1, 2, or 3. And then you can go down these risk factors: pulmonary, cardiovascular, obesity, diabetes, renal, and the more severe the risk factor, the higher the number. And you can see at the bottom that what you do is you add up the numbers. If you have less than 7 points, you're low risk. If you have 8 to 14 points, you're moderate. And if you have 15 or greater, then you are high risk. Here is a continuation. So this is really the same chart, but ongoing with renal, hepatic, and immune compromised states. Okay, and next, please. Now, this is the same data, but put into a decision tree. And this is FSIPP, as you can see. So what this is if you know the COVID status, it's either yes or no, right? If it's yes and the person is recovered, then you can go on with your procedure. But if you don't know, then what you have to do is base your moving forward on symptoms. Now, if there have been symptoms within the past 14 days, refer for testing and try to define whether or not you're dealing with an active infection. But if there have not been symptoms, then what you do is you try to stratify risk. And there's low risk, moderate, and high. If it's low risk, go ahead with your procedure. On the other hand, if it's moderate or high risk, then what FSIPP is recommending is a risk, benefit, and clinical judgment based on the severity of the patient's pain symptoms. So it's not a clear no, but it's really a decision based upon the suffering and the risk of the patient at the time you want to do the procedure. Okay, next. Okay, so what these are, and this is from ACIP, these are frequently asked questions regarding return to practice. We have, what procedures am I able to do right now? So this is really based upon the decision tree that you just saw, based upon risk factors, also any kind of local state limitations that you may have. Next is, should I use steroids in my injection? That's a good question. There has been some preliminary data that steroids may increase the risk of COVID infection. So using normal steroids just without thinking is not the right way to go. On the other hand, it's not a clear no either. So use as little steroid as you can possibly use under the circumstances that you're treating. What PPE do I need to use at the office or during procedures? So this is a full face guard and consider a face shield. Next, should I sedate my patients? So, offering sedation to patients is common. However, it does increase risk, so do so carefully. Next. Thank you. Guys, there are a whole bunch of questions here. I'm not going to go through them in the interest of time. This presentation will be available to you on the FSIPP website. Really, it's a wonderful discussion, but I would like to get on to our next speakers. And we have here a consent form for doing COVID or for doing procedures in our current era. And that is the end of our presentation. And Harold, thank you for writing that. A terrific presentation and a terrific summary of current recommendations. Okay, so now it is my pleasure to introduce Judy Holmes and Dr. Hans Hansen. So Judy received her bachelor's degree from Colorado College, her JD from the University of Denver. She has practiced law for more than 30 years, has extensive trial experience defending healthcare providers in medical negligence cases and employers in employment-related suits and claims. Her practice focuses on advising healthcare practices on risk management and on employment law issues. She's a frequent speaker on practice management topics. She has authored numerous articles and textbook chapters on risk management, employment law, and compliance issues. She is dynamite, and we are so happy to have her. Now, she has the honor and the pleasure of presenting with Dr. Hans Hansen. If you guys don't know Hans, you have not been around for the last 15 years. Hans is everywhere. I just don't know how he does it. He is a past president of ACIP. He is a highly sought after speaker just because he's so good at it. When Hans speaks, he brings you to the moment when you have a decision to make in your practice. It's like real time. It's amazing. Anyway, I am so happy to have you both, and please go ahead.
Thank you very much for that introduction. Hey, Judy. You there, Judy? Okay, can you hear me, Jesse? Judy, can you hear me?
I hear you, Hans.
I can hear you.
Okay, we're in. It's a whirlwind. Anybody that's been doing these, I guess, internet visits, we'll call them telemedicine or whatever, has been fighting Netflix and all the bandwidth sucks that we never had to experience before. But we also haven't had much experience with the issues we have with employees to the extent that Ms. Holmes gets into, and that every once in a while we unfortunately trip over. All right. we've been asked 5 discussion points to be expanded upon, and they're really good. I think they're really good points. You know, with COVID out there and all this uncharted territory we've got, we have to understand what we're doing. So it's a unique situation. It's territory we've not seen, and there's going to be legal principles that'll guide you. This is not legal advice. It shouldn't be legal advice, right, Judy? It's
Right.
not legal advice, right? But it's thoughts on how to navigate your way through tough scenarios, and we're going to talk about all those. So next slide, please. All right, discrimination. That's a huge word to practice. It's kind of like the C word to a patient. You get these questions. You are bringing her back and not me. That's discrimination, and I'm going to sue you. Have you ever noticed that every patient has a lawyer? They seem to have a lawyer. She's getting more hours than I am. You are discriminating against me, and I'm suing. Judy, are we in trouble?
You know, often when employees think something is unfair, their first words out of their mouth are discrimination and lawsuit, and that can be pretty unnerving. So it helps to understand what discrimination is and to put things in perspective. So I apologize here, get this little thing. All right, let's put it in perspective. First of all, is all discrimination unlawful? No. Do you have to treat every employee the same? No. In order for discrimination to be unlawful, the treatment must be based on membership in a protected category. So what exactly do we mean by that? Federal discrimination laws apply to businesses with 15 or more employees, and under those laws, it is unlawful for an employer to discriminate against an applicant, an employee, or a former employee based on their membership in a protected category. And you've seen those categories before. It's things like race, national origin, disability, age over 40, and on down the list. With military discrimination laws, it applies to all employers, not just ones with 15 or more employees. Now, Florida has its own protected categories, its own statute, and the categories are a little different. And as a matter of fact, even some municipalities have ordinances listing their own protected categories. Now, just because you don't have 15 employees, that doesn't get you off the hook. There are several other causes of action that may apply, so it's important for everyone to manage their practices as if those state and federal discrimination laws apply. So for every employer, there are 4 key points. Number 1, don't make any employment decisions based on race, religion, gender, and those other protected categories. Number 2, treat similarly situated people the same. And we'll be talking about exactly what similarly situated means. Number 3, have a job-related legitimate business reason for the decisions that you make. And number 4, of course, document well. All right, let's take a case study. You have 2 MAs, you furloughed them both, and now you can only bring back 1. What do? Well, you got a couple of approaches here. Here's one approach. You say, Michelle, I'm bringing John back instead of you because we like to keep the younger MAs. It's good for our image. Male MAs are much easier to work with. And frankly, you know, your religion, your ethnicity makes other staff members uncomfortable. You could do that, but that would be unlawful because you are basing your employment decision on those protected categories: age, race, gender, religion, and ethnicity. Now, here's another approach. Let's contrast that with, okay, I'm bringing John back instead of you, Michelle, because he has a better attendance record. He's been with me longer. He has more skills. He participated in training and you refused. And patients have made complaints about you and not John. So you see, with this second approach, you're making your decision based on legitimate business, non-discriminatory reasons, and that would be lawful. So now all you have to do is document well, because you may be second guessed and you may need to produce the evidence that you made a legitimate business decision. Now, as for that term we talked about, similarly situated, just because they're both MAs doesn't mean they're similarly situated. You know, Michelle's a bad employee and John is a good employee. So the takeaway from this is that you don't have to treat everyone the same. You can reward good employees and you can discipline others. You just have to have a legitimate, non-discriminatory business reason and then document well. All right.
Next slide. I'm not coming back to work. I'm kind of liking it here at home. Next two questions involve something that I think we're all faced, and it's the fact that patients are all there. We need to see them, and we need to ramp back up, and we need to get something going in our practice that's viable, not now, but 3, 6, 9, 12 months from now. But some of these employees are getting bigger checks staying home than coming into work, and that's the reality. So they like being home, they're getting paid more. What are you going to do? When employers refuse an offer to come back to work, at what point have they abandoned their jobs, Judy?
Well, in answering those two questions, it's good to understand a concept that will help you. Florida is an at-will state. So what does that mean? Well, it means either party, the employee or the employer, may terminate the employment relationship with or without notice at any time, for any reason or for no reason at all. And I put those asterisks there because you can terminate someone for any reason except an unlawful reason. So you don't want to base your termination decision on those protected categories we talked about: race, sex, religion, and the others. You also don't want to base your termination decision on the fact that someone engaged in lawful activities. Now, what do I mean by that? It's like somebody filed an OSHA complaint, or filed or went out on workers' comp leave, or filed a harassment claim. That's all very irritating, but avoid making a termination decision or discipline decision based on that, because that's a lawful activity and you may get a claim of unlawful retaliation.
Okay, next slide, please.
Yeah, I'm sorry. This is a bit tricky.
Yeah, it's kind of slow.
All right, let's try this.
All right, there we go.
Oh gosh, I'm sorry. So actually, all right, so the bottom line is your employees have issues, but so do you. You're running a business. You have a legitimate business reason for needing your employees to return. And believe me, those who have returned, who've followed your request to come back, they're taking on extra duties, they'd rather not be there, they're watching you. They're watching how you are handling this decision. So if all else fails, you ask them to come back and they won't, well, termination is an option. But before you do, consider all issues. Look at your employee handbook. Look at your policies and procedures regarding leave of absence, vacation time, paid time off. Look at your definition for termination for job abandonment.
Yeah.
Okay, there you are. Okay, sorry.
There we are.
Also look at the job duties. You might want to think outside the box to see what you can do to help. But remember, that's a slippery slope. You're going to get the claim, hey, that's not fair. And I always tell my clients to be careful and remember that fair is a 4-letter word. You shouldn't promise it because you can't deliver. What's fair to one person is not going to be fair to the next. What's fair to you is not fair to the employees. So you don't want to base your decisions on, a promise, hey, I'm going to be fair to everybody. So in the long run, it's okay to look at your policies on termination, look at your job duties, follow those handbook provisions, and insist on compliance.
had a little bit of extra time to go through some of those things. All right, every situation is different. You have to treat similarly with people that are situated at the same time and space. Give written warnings if you need to, check with counsel. I always think it's to have a go-to phone number. I have a go-to phone number. If you document well, you get good legal advice. It doesn't have to be a big fee, but what you're doing is spending good money after good. You're keeping your practice going. It's a business, so think outside of the box. Next slide.
And you want to address that next little bit there about the kids? We argue about that.
Yeah, we had a little discussion about this. I sink to vision sometimes, and being an employee, law attorney, right finger, right way, whatever. You have to have policies and procedures in place that don't let you sink into quicksand. And Judy, tell us how it could be quicksand pretty quick.
We were arguing about bringing kids to the office, which we can deal with later. So we'll go on with a very tricky disability issue. What I'm finding is that people who don't want to come back to work and the office is open, they're getting pretty savvy about trying to find a loophole. And they're starting to say, oh, I can't come back because of my disability. And, you know, avoid the temptation of saying, oh, you don't have a disability. Under the Americans with Disability Act and Florida's corresponding disability law, that is defined so amazingly broadly. I don't think any of us can say we don't have a disability. So what you need to do is recognize a disability is very broadly defined. It may be an intermittent condition like migraines. It could be a mental condition, anxiety, depression, PTSD. Just take the claim seriously. Don't challenge, and just understand your responsibilities. So what are those responsibilities? Well, the EEOC has just released some guidelines that say that employees with pre-existing mental illnesses or disorders, now that's whether you knew them before or not, that have been exacerbated by the coronavirus epidemic may be entitled to reasonable accommodation absent undue hardship. And an employee who is already giving a reasonable accommodation may be entitled to an additional or altered accommodation. So keep that in mind. So what are your responsibilities if you get this? I can't come back to work because of my disability. Well, you need to enter into the interactive process, and we'll talk about that, because you need to determine whether there's a reasonable accommodation that can be made without an undue hardship to the practice. So let's take an example. And this is a real medical practice that's dealing with this. It's not a client of mine, but the office manager got the call that says, well, I have claustrophobia and I can't wear a face mask, so I want to work from home. Okay, well, what are your obligations? Well, first you want to look at the job description, find out what those essential functions of the job are, and then enter into the interactive process to determine if you can find a reasonable accommodation. Well, the trick to this is that the person who was calling in, is the front desk person. So an essential function of her job is to get to the office every morning, open it up, and be at the front desk. That's essential to her job. She knows darn well she can't work from home. But what do? You enter into the interactive process, and it can be just as simple as this. Well, Michelle, you go to the grocery store, don't you? Well, yes, I do. And you wear a mask? Well, yes, I do. But it really bothers me, and I can only wear it 45 minutes. Okay, then what do? Well, I have to take it off. For how long? Well, at least 5 minutes. Okay, there's your interactive process. Now you have to determine whether there's a reasonable accommodation that can be made without undue hardship to your practice. And that's a case-by-case determination. Depends on your office, depends on the job and everything. But you know, you know, you're going to have to decide whether you can give her a break every 45 minutes to go downstairs and take her mask off, or whether you can put plexiglass, or, you know, give her another job. That's entirely case specific. It just has to be reasonable. And, you know, if she can't perform the essential functions of her job, and there's no reasonable accommodation that can be made, although you have to really stretch hard and do everything you can to make a reasonable accommodation, then she can't, she's not qualified for her job. So basically, the takeaway from this is on the next click. Okay. Is to determine whether a reasonable accommodation can be made. Don't argue whether it's a covered disability because it's so broad. Just see what you can do and work real hard to figure it out. Document your efforts, and if it's a sticky situation, this is a time for getting your employment counsel involved. So Hans, I'm going to wrap that up.
Yeah. Well, they've asked us to also cover physicians that are employees of groups, or you have an employer that, okay, yeah, wants to bring you back, but in a different capacity. You can go back to the other slide if you want.
No, that's all right. You're right here now.
Yeah, there's a number of issues involved for us. Some of us were furloughed, some of us had our own practice, but we employed physicians. I mean, you know, think of all these scenarios. We're reopening, how are we bringing them back? And what are we telling them? And let's face it, accounts receivable are down, and we're going to do the best we can to get everybody back. So you've got some contracts. What do you do?
If you're not on a contract, and there are two situations. If you're not on a contract, you know, those at-will principles apply. If you're just an employed physician in a practice, you know, you can determine whether it's right to leave. Is the employer doing the best he can? Is it job related? Is the bringing you back in a different capacity in a different location? You know, do they have a legitimate business reason? Often it's important to work with the practice to come up with a compromise. Now, if you are on a contract, then you know, you want to look to the terms. You want to look at specifically, obviously, you know, COVID virus protocols aren't going to be in your contract, but you're going to want to look at you know, what are the terms in the contract? Can you terminate the contract for cause or not for cause? Look at the definition of both of those terms. Look at the notice requirements and look at the compensation requirements for early termination. Those are all important to do. And again, I've been saying this, I sound like a broken record, but you might want to check with your counsel on your best options. Hans?
All right. Yep. All right. Safety. We're kind of winding it up here, but we got to talk about safety. You have an employee who's not practicing good personal safety habits and putting everybody at risk, including you. Potentially, you're going to take something home or to loved ones. And most importantly, you know, what are we doing for our patients that we have our first and foremost obligation to first do no harm? So what do you do when you've got an employee putting everybody at risk, or some people at risk? All right. Go ahead, Judy.
Well, before you reopen your office, you ought to have written policies and procedures and clear guidelines in place with all the CDC guidelines and everything. Include a written warning of the consequences of not adhering to the protocols, and then document that everyone has read and understood what is expected of them. Get a commitment from their employees that they'll comply. I mean, it's going to help everybody. I think you get, you know, input gives buy-in, and so get their input. Make sure they're on board with creating the healthiest atmosphere they can, and then follow through with your safety plan. The one last point is be careful of privacy issues. In the case of a virus, what people do in their off-duty time is a concern. You know, are they partying and engaging in off-duty conduct that may prove harmful to the practice? It is important to know, but avoid stalking your employees through Facebook or Instagram or other social media. Don't ask your staff to be a truth squad and report to you about their employees, about your employees. The point here is that you don't want to invite, you know, morale issues for one thing, and at the worst, a breach of privacy complaint. A safer way to handle it is to test, and EEOC has relaxed their restrictions on testing. Dr. Lipnick has talked all about the tests and you know, what tests to choose, and the new EEOC guidelines will help you with that. They allow employers a broader legal basis to do the testing. They can conduct testing for the virus to determine if employees entering the workplace have COVID-19, because if they do have the virus, these employees could pose what is called direct threat to the health of others, and you can take action. The ADA requires any mandatory medical tests of employees be job-related and consistent with business necessity. So if ever there was a time that you can prove it, it's this COVID-19 testing. Want to wrap it up, Hans? Oh, whoops, let me see.
Yeah, go back one. All right, well, it all has to do with the risk reward to not only you and your practice, but obviously the title says it all. It's a balancing act. I guess what I would want everybody out there to do is don't practice in fear. You know, if we undertreat, we make mistakes. If we overtreat, we make mistakes. But we listen to the little voice on our shoulder, and we just balance our thoughts and our experience. We're going to win. But don't forget to get counsel involved. And that's a good one right over there.
Hans and I put out a short email newsletter dealing with hiring and management issues, and we update on employment law. So if you want to be on the list, just go to beststaffelver.com and enter your email address, and then you can download a guide that we put together on effective hiring, effective lawful hiring, and then you'll also get the newsletter. So thank you very much. I'm sorry about my terrible slide ability.
You did great, Judy. And we'll be around for questions a little bit. And I think Harold's up next.
Thank you so much, Judy. Thank you so much, Hans. These are important questions that everybody is wrestling with right now. We are trying to get our practices running, and we're all facing these issues, and it's uncharted territory. We've never been in these waters before. So thank you so much for giving us some guidance there. Okay, guys, now you've heard guidelines from national organizations, including the White House, the CDC, and FSIPP. You have heard questions of employment law dealt with by Judy and Hans. Terrific. Now we get to hear from Dr. Harold Cordner. So by way of introduction, Harold is a past president of FSIPP. He's the current president of FSIPP. He is going to discuss the payroll protection program and what are the requirements for loan forgiveness or repayment. Harold is trained in anesthesia, subspecialty certified in pain management. He is the associate clinical professor at Florida State University College of Medicine. He's an editor of Pain Physician and Neuromodulation. He has been in private practice in Vero Beach more than 20 years. It has been my pleasure to serve with him at FSIPP. I always learn something by watching Harold. He's a great, they say you need a friend and you need a teacher. Harold is both. Just terrifically knowledgeable. I don't think Harold sleeps at night because I don't know how he gets it all done. I give you Dr. Harold Cordner.
Thank you, Jesse, for that wonderful introduction, which I don't deserve. But I am going to talk today about Payroll Protection Act and the loan forgiveness. I'm sure most of us have gotten these loans, and how do we now make sure that we don't have to pay it back? And it's actually a fairly complicated thing, and I always say the devil is in the details. So I'll get into that. And my disclosure, of course, is going to be I am not an attorney and I am not an accountant, but I'm just going to go through the application just came out last Friday for the loan forgiveness. And there will be some changes. Most likely, they have not given the bank all of their recommendations, and in fact, there's already been some changes in line, which we'll talk about in a little bit. So let's go to the next slide. Okay, so this is there's basically 11 pages of the application, and I'm going to go through most of this in some fair detail. So the first thing is pretty obvious, is that, okay, well, what things are covered, okay? And so the summary of costs eligible for forgiveness. So what things can, what costs are forgivable? And these are pretty much the same as when you did the application. So they define basically what the costs are. So eligible payroll costs. So they define what payroll costs are considered paid. The paid date is when the payroll check was distributed or when the direct deposit ACH credit transaction was done. But the payroll costs are incurred when the payroll is earned. So when we took out this loan, I was concerned, well, if my payroll starts next week, do I lose a week? And that they kind of covered that in this. And so the two ways to do this is, one is that if your pay period ended a week before, or you're paying them the week after, you are eligible for forgiveness if that pay period was paid on or before the next regular payroll date. So you have a little forgiveness there in that regards. And on top of that, we'll go for this. The eligible non-payroll costs. This is a little interesting, is that covered mortgage interest. So you can't write off the principal, but interest. So if you're paying a mortgage on your building, you can cover the mortgage interest only. The other interesting thing is the covered rent obligation. So you think, okay, well, it's rent for my building. Well, it also says that it's for real or personal property. So if you have a lease for a C-arm or other personal property that was in force before February 15th, 2020, those are theoretically covered as of this date, as far as our interpretation of that goes now. As well as covered utility payments. So if you have telephone, internet, water, et cetera, all of those utility payments are also eligible for forgiveness. The caveat for that is the total of all of those non-payroll costs cannot exceed 25% of the total forgiveness amount. So 75% has to go towards payroll and 25% to the non-covered expenses, okay? That was the same as we had on the application. So here is the next thing where they talk about the covered period. And this is where it's advantageous for us. So the covered period starts on the first day that you get your loan dispersed into your account. So if you're got your loan on May 1st, then the clock for 8 weeks or 56 days starts exactly on May 1st. So what would happen if your payroll started the week before? And so that your second week was in May 1st, but you're not going to get paid till the week after that. So the other alternative payroll covered period is you can choose this on your reporting on your application for forgiveness, is that it could be the period that begins on the first day of the first pay period following the loan disbursement date. So if your payroll started, your next payroll period started on May 8th and you got it on May 1st, you can call that alternative payroll covered period there, so you get the full advantage of 8 full weeks of payroll, not 7. So that happened to some people that got caught in between. So they covered that aspect nicely in this. So next, this is where it gets a little complicated. This part of the application is basically your schedule for payroll and FTEs or full-time equivalents. And what they've done is that if you have not hired back basically to what your full FTE was prior to your loan or in February or the year before in 2019, depending on which date you pick, if you're only at 75% of your FTEs or 75% of your payroll, then they're going to deduct 25% of your loan forgiveness request on the application by that percentage. And so this is part of that. And there's several tables that they're using to do this. So table 1 is up on the top there, and that is for employees that made under $100,000. You are basically going to list all your employees in those tables with what it cost you for payroll during that period of time. And table 2 is for people that made over $100,000 on a per annum basis. So the maximum that any employee that makes over $100,000 per year is allowed to be forgiven is $8,333 per month. And so they're going to separate out the employees that make over $100,000 from the other employees so they can keep track of that. That gets important later on as well as we talk about. So this is the instructions on how to figure out Schedule A. And so the bottom part of that, as I said, it's a fairly complicated thing. You're going to have to take the number of employees you had, and if they have been reduced in their hours and been reduced in their payroll amounts, or if they were getting $36 an hour before and now they're making $25 an hour, each single employee, you're going to have to take that calculation and calculate how much of an FTE that is. And that goes into that table 1 that we talked about earlier. So these are kind of the instructions on how to do that. And I'm trying to advance this. Next slide, please. There we go. Okay, and so 2 advantages that they've also given us are an FTE reduction exemption and a safe harbor. And these are very, very helpful. We'll go over both of those in detail. So the reduction exceptions, so there are some. So if you have given an employee, you furloughed them and asked them to come back, and they rejected their offer to come back, that does not count as one of the FTE reductions. So if you had 25 employees and you gave 5 of them furlough and 4 of them decided they didn't want to come back because they're making more money, if you have given them a good faith written offer and they've rejected it, those employees who did not come back, you still can, you do not have to reduce them from your FTE reduction. So if those 4 employees don't come back, you can still claim the salary for those 4 people, and you're not going to suffer reduction in FTE. And then the others are employees that were fired for cause, voluntarily resigned, or they voluntarily requested and received a reduction in their hours. So we have some people that came back that did not want to work full time. So we don't get penalized, or you're not going to get penalized for people that voluntarily requested a reduction in their hours for the forgiveness. So that's very advantageous to you if you have that. The safe harbor is even better. So this, if you have reduced your FTE levels beginning the period between February 15th and April 26th, but you've restored your FTE levels by June 30th, you will not get any reduction in your FTE forgiveness. So even if up until June 25th you have reduced hours or payroll, as long as you come up to the original number of FTE that you had during that period of time, that loan will be forgiven. So that's really helpful. There is some legislation both in the House as well as the Senate to extend this period for up to 24 weeks. So right now we're at 8 weeks, and they're concerned because there are some businesses such as bars and movie theaters, et cetera, that can't get back to normal work. So it looks like there probably will be a bipartisan bill to extend the dates of the loan forgiveness past the 8 weeks. So we'll see how that's, we'll see that in the next few weeks probably. And again, as I said earlier, these things are changing. They're coming out with more clarifications as questions come up. So this is the way the application and the guidelines to the banks are now. That may change. So keep abreast of that and keep in touch with your banker. And there's a fair amount of information on the web as well, on the SBA website. So this now is documents that one, you must supply with your forgiveness application. And so I'm going to go over those because you're going to need to start collecting these documents now and making sure you have that. Just as if you offered someone the job back and they didn't want to come back, make sure that you have a written offer that they came back and some kind of communication that they did not want their job back. So we'll go over these things. So here's documents that you're going to have to submit with your forgiveness application. So for payroll, you're going to need bank account statements or third-party payroll service provider reports documenting the payroll amounts that were given, as well as tax forms. So typically the IRS 941s, those are your monthly payroll reports that show how much payroll was paid, as well as payroll taxes, Social Security, Medicare, state, FICA, all those kind of things, as well as the state quarterly and wage reporting and unemployment forms as well. So keep all those things. Make sure that you have those things for your application when you go to do that. If you have given employee health insurance, you need to have either canceled checks, the receipts from the health insurance company, or account statements documenting the employer contribution. So you cannot deduct the employee contribution. So if you pay half of their health insurance, you can only get back forgiven the employer portion contributions. Okay. And same for the retirement plan. So if you match their 401k, make sure that you have the documentation of that employer contribution because that is forgiven as well. Okay, as far as the FTE, so this is there's 2 pages of this FTE. They're really stuck on that at this point. So again, you have 2 pay periods that you can look at to where your FTE started. One is going to be the dates between February 15th, 2019 and June 30th, 2019. Or you can pick between January 1st, 2020 and February 29th, 2020. So whichever works out more favorably, you can, if you had less employees in February 2019 than you did in 2020, you can pick that. So either one of those dates will be where your baseline of your FTE goes and where you'll be compared to at the end of your loan forgiveness 8 weeks, or that June 30th date that we talked about earlier. Most of you are not seasonal employees, so that other part does not really employ you. But if you're seasonal, those things change, but we don't really have many seasonal doctors here. The next thing is the non-payroll covered items that we talked about earlier. So your mortgage, so you have to have a copy or your amortization schedule and receipts or canceled checks for your mortgage payments. And so again, you have to have the amortization schedule to separate what was principal and what was interest, because you can only get forgiven on the interest in that mortgage. Business rent or lease payments, so you have to have a copy of your current lease agreement and receipts or canceled checks verifying the payments that you made during that covered period. Okay, so make sure you have a copy of your lease with the application, as well as canceled checks or receipts from your landlord that you paid them in cash. Business utility payments, the same thing, copy of invoices from February 2020, and then account statements, canceled checks, or receipts showing that you paid those utility payments. Next, there we go. Thank you. All right, so these are also documentation that they say that you need to maintain, but you're not required to submit them. And this is in case of an audit. The SBA can audit anybody for any reason. That's also in their regulations, that the bank can be audited as well as the applicant. So they're requesting those things. I don't really need to go into in a heck of a lot of detail. But again, you want to have documentation. So when you put in the PPP Schedule A, so that was all your full-time employees, and specifically for 2, the employees that made over $100,000, documentation from all of those things for payroll reports, etc. The documentation about job offers, refusals, firing for cause, all those things. Again, you need to have those things. Your safe reduction harbor, so that you show how many FTEs that you had starting on just June 30th. And then all records relating to your loan. So when you applied for the loan, all the documentation that you submitted to the bank for your loan application, all of those things, all the documentation, to have all those things. So make sure that the documentation is there, because if you do get audited, you're going to need to just supply all those things. And the SBA has a website with that application on there, so you can look at that. I anticipate there is going to be some clarifications and changes, as I said earlier, hopefully for the better. And that is about it, I think. My email, you want to click the next one? That's my email address there. If anybody wants a copy of the presentation, will be available up on the FSIPP website, or if you have any questions or emails, feel free to call me or email me, and that's the end of it. And hope you all get your money back. Thank you.
Harold, thank you so much. Guys, we are now ready for questions. If you want to submit a question, you can text any of us if we're in your telephone. If not, there is a chat box on this GoToWebinar function. You can write a question in there, and those questions we will try to answer them now. Right now, I have one question, and I'm going to read it. Can an employee demand to go on FMLA for COVID reasons and milk their entire time without you, the employer, being able to fire or replace that person? And I think this is really meant for Judy and Hans.
Go ahead, Judy.
That's a really broad question that I can't say yes or no on. It's very broad. First of all, I'm assuming your practice, Family Medical Leave Act, at least the federal act, applies to only practices with 50 or more employees. And it is so complicated as to how to comply with them, that if there's an employee that you feel this is going to be troublesome, you know, I sound like a broken record, but the liability for doing it wrong is significant. So you may need to get somebody who can take the specific facts, apply them, and you know, it's well worth the money.
Okay, so don't do this without your employment attorney.
Well, my bottom line is it depends on a whole lot of circumstances. So I don't feel like I can really respond.
Thank you. Harold, you're just texting me, give instructions to chat questions. What are you referring to? You're on mute. Harold, you're on mute.
I'm good. Just so that the attendees know, we've only really had one question, that they know where the chat box is so they can open that up and click on it and type in questions for any of this esteemed panel.
All right. Well, all right. So I think that's it in terms of questions. If we get any questions, please contact any of us. You have Harold's email. Our emails are available. You guys, just in case people don't have them, would you mind just going through them real quickly? My email is easy. I'm docrehab@AOL. That's Jesse Litnick. Judy, what is your email?
My email is, and it's actually in this presentation too on one of the slides, it's Judy, Judy, at jholmes, HOLMES, law, LAW.com. And Hans?
Yeah, it's on a slide here, but it's lowercase h Hansen. That's HHANSEN. I'm a dumb Dane. At pain relief centers plural.com. Hansen painreliefcenters.com.
All right. Thank you, everybody. I'd like to thank Michelle and her entire organization, Mantra Meetings, for allowing us and giving us the facility to put this on. Thank you so much. I'd like to thank all of the participants, Harold, Judy, Hans. You guys rock and roll. Awesome. Just awesome. Thank you.
You're doing a good job, Jesse, as president, and it's showing. Okay, Harold, you too.
Thank you.
Okay, guys, what you heard tonight was you heard a presentation on national guideline recommendations for getting back to work. Then you heard legal issues that you might deal with and that we all need to be aware of from Judy Holmes and Hans Hansen. And then you heard how to be responsible in your loans and get the best possible loan forgiveness and stay legal and out of trouble from Harold. So thank you so much, everybody. I would like to remind everybody that we are going to have our annual meeting, FSIPP. It's going to be July 16th, 17th at the Diplomat Hotel. Don't miss it. It's going to be awesome. It's going to be the best meeting of the year. Actually, it might be the only meeting of the year. No, I'm kidding. I'm just kidding. But anyway, it's going to be dynamite. Please sign up and come. We have safety first, and we have a fantastic presentation.
There is a question there. There's another question that came in.
I'm sorry. Yes, a question.
No, I can answer this one.
Yes.
So the question is, I have an employee who works 1 day per week but gets paid commission. How much FLA do I pay her? So the definition of payroll cost includes anything that's reported on the taxes. So wages, commissions, bonuses, all those things are eligible for forgiveness. So if you pay them commission and it goes on their tax forms or yours, it's eligible for submission.
All right. And do we have any other questions here? All right, guys. I think, Harold, do you have one?
Looks like another question. Is it capped at $200 per day or 2/3 of biweekly pay? So the only thing that they have in there as far as capping is if the employee makes over $100,000 per year, amortized. So if they've made over $100,000 a year, they have to go into that exemption, and you can only take the first $100,000. So it doesn't really matter if it's $200 a week or whatever it is. It's $8,333 per month. Okay.
All right. Okay, and with that, I think we have finished our webinar. Thank you, everybody.
Cheers.
Good night. Cheers.
Good night, all. Thank you.